I bet you didn't know that they use Adderall to study the effects of cocaine and methamphetamine on the brain. It's not because Adderall is the same chemical compound as cocaine or methamphetamine. It's that Adderall has similar effects on the receptors in the brain, and because it's a stimulant like methamphetamine or cocaine, they use it because it's ethical to use Adderall. You can't go out and using illicit drugs to study the effects on the human brain. There's standardized dosing with Adderall. The mechanisms are similar, although not the same. And it also gives us modeling for understanding ADHD, addiction, and sort of that reward system of dopamine and whatnot. Anyway, this isn't my opinion. You're readily available information. People have asked me what I think of medications like Adderall. What do I think of medications like Adderall? I personally am not a fan. I don't suffer with those things. I don't have any children that suffer with ADHD and ADD. I will tell you that ADD and ADHD were never I don't believe they're a legitimate diagnosis. We don't have a blood test for them. My understanding, and it could be wrong, is that ADD and ADHD were voted in by a show of hands at a conference amongst psychiatrists and psychologists who said, hey, we have this set of symptoms. Do we want to call this a disease? So it was more of a voting than an actual thing. I'm not saying people don't suffer. I'm just telling you that's what I've heard. And I bet you didn't know that Adderall is used to study the effects of cocaine and methamphetamine on the brain, because we can't just give illegal drugs to human beings to study them. So Adderall is used in its place. Again, not because it has the same mechanisms exactly, but because it has similar mechanisms and it is ethical, standardized dosing and whatnot. So that's some information you should know. Lots of people are going to ask me, what can I do for my attention deficit disorder? What can I do for my kids' attention deficit disorder? It's so hard for me to answer that question because I don't know you. I don't know your lifestyle. I don't know your environment. I don't know your diet. I don't know anything about you. So telling you what to do would be inappropriate at best here on the internet. One of the things that I would tell you is absolutely get rid of refined sugar, get rid of the toxins in your diet, eat a low inflammation diet. Those are things that I could easily tell somebody to do without any risk on my end and without knowing you. Anyway, I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. We do root cause functional metabolic medicine. It is our goal and our mission to help people without the use of drugs and surgery. Hope you found this helpful. Leave me some comments below. Take care today.